also known as ASD. The most common type of ASD is called a secundum atrial septal defect. A secundum atrial septal defect is a hole in the wall between the two upper chambers of the heart. Before birth, it is normal to have an opening called the patent foramen ovale in this wall. This opening usually closes shortly after birth. Sometimes the wall between the chambers doesn't develop completely. As a result, an abnormal hole called an atrial septal defect is left in the middle of the wall. This opening allows blood to move between the upper chambers, which increases blood flow to the lungs. If the hole is large enough, the increased blood flow leads to enlargement of the heart and can also damage the blood vessels in the lungs. It can also lead to abnormal heart rhythm due to injury to the heart muscle. Most children do not have symptoms, but those with a large defect can have slow growth and rarely a condition called congestive heart failure. Treatments for ASD may include medications for symptoms, but the definitive treatment is closure by either cardiac catheterization or surgery. If the hole is large or hasn't closed by age 2 to 5 years, a catheter or surgical procedure may be necessary. During a catheter procedure, a tube called a catheter is inserted through a small incision in the child's groin. From there, the catheter will be threaded through blood vessels to the child's heart. Next, the doctor will place a device called an atrial septal occluder across the defect to plug the hole. The device will stay in the heart and prevent blood from crossing between the upper chambers. Then, the catheter will be removed from the body. When the hole is too big or when there is no place to attach the device, open heart surgery is necessary to close the hole. To begin, the surgeon will make an incision in the chest. Once the heart is reached, the hole will be closed with a patch. The incision will be closed and covered with sterile dressings.